and those elements. And pretty much anything that we do, we have that input from them. Outside in the wider community, straight away, groups of residents in their local areas, and we've got some ward councillors on the meeting, and they will know as well. They came together and they started to look to support those that are most vulnerable. And it wasn't the standard, if you like, vulnerability sector. There was an additional element in there, which was around those people that were shielding, where they had maybe a historical medical condition and they were very, very vulnerable, and they had to basically isolate themselves. But they needed to still have, you know, access to their medicines and to food, and sometimes just contact, because we may touch on it later on, but the mental health element of all that's gone on has taken a huge toll on lots of our people. So lots of these groups came together, and on the wider picture, we were very fortunate. There had been a conversation going on for over a year with the third sector group. You heard them, they're called 3SG, where they wanted to basically bring all those third sector partners together and provide a good level of support. And straight away, the 3SG, the council and Virgin Care, plus a few other partners as well, they came together. And what in the normal council world would have taken 6 to 9 months to pull together, because we would have had to have a meeting about this and all, and we talk about the budgets and everything like this. They set up the Compassionate Community Hub in literally about 10 days. And that was a phenomenal piece of work. And that hub has been there, and it supported a lot of the work that's been happening in the very localized areas, you know, in Chew Valley, in Keynsham, in Midsummer Norton. At first, there was a little bit of positioning because, you know, obviously people in their locality, they think, well, you know, we're doing this okay, you know, but very quickly they realized that the hub could add an extra level of support to the community, because many people, where it might have just been they needed some food or they needed medicine picked up and everything like this, it was quickly realized that a lot of people actually have multiple needs. And by using the pods in the hub, we could actually seamlessly support those people. And I think if David and Sarah speak later on, they'll give you an idea of the numbers involved. And I know we've got Claire on the call, and Claire has been working really hard with Joe Scammell, who's the Virgin Care lead in there. And together, they really, really cemented the relationship. And I know there's been a lot of historical chatter about, you know, about Virgin Care and everything like this, but believe me, they've really stepped up to the mark and not only contributed in terms of the community hub piece of work, but while all this has been going on, they've actually been making sure all those people that need care out in our community still receive it, looking for innovative ways of doing it, using technology and things like that. So I just thought, you know, they were worth a shout out on that point. I'll hand over to Becky, because Becky will maybe give us a better flavour of the challenges that they've experienced and the way forward that the public health team have seen and directed us. Is that all right, Becky?
That's fine. Thank you very much, Rob. Can I just check that people can hear me, because my microphone isn't always brilliant. Okay, thank you. So my name's Becky Reynolds. I work in the public health team. I'm a consultant in public health, and Bruce Lawrence, who's the director of public health, is my boss. He's on leave for these couple of weeks. Otherwise, he would be here. So I'm here in his place. So thank you very much for it's lovely to see you all. I was at Chew Magna. I live over in Oldham Common, so I live a fair distance away from your area, but we enjoy cycling, and we were over in Chew Magna over the weekend and enjoyed a very nice lunch, our first lunch out in a pub, daring to go out and eat out in the pub's back garden, and thoroughly enjoyed our ride over your way, so that was nice. I'm going to look down occasionally just because I've got some notes, and I just want to make sure that I don't sort of miss things. So just to give you a bit of an overall sort of state of the outbreak, I think you've probably picked up from the news that in the southwest we've done relatively well compared to the rest of the country, compared to the England average in terms of the number of cases that we've had. And part of that is thought to be structural because we have a very relatively rural part of the country compared with very industrial parts of the country. Part of that is because we haven't got huge big cities with people having to live very close together, and partly because as a whole our population in the southwest as a whole is generally a healthier population than the health of the population of the England average, so we start from a relatively slightly better place. And hopefully we'll continue to do well because some of those things are structural. But we have had cases, and we've had just over 350 confirmed cases in Bath and North East Somerset since the pandemic started. So those are confirmed cases. So that means that in reality, we've probably had a few thousand actual cases. But many people, as you will know, either don't know they've been ill or have had a very mild illness and have put it down to a mild cold or something. But we've had 350 confirmed cases. So that means that almost everyone has not been infected and almost everyone is not immune. And we also don't know, even if someone has an infection, whether that will give them immunity enough to resist a future infection, and if so, how long immunity lasts for. But we haven't got off without pain, and very sadly 92 people to date in Bath and North East Somerset have died because of COVID, and over half of those have been in care homes, which is slightly higher than the national average in terms of the proportion of deaths dying in care homes. And to some extent that is probably a result of national policy decisions about people being discharged from hospitals in order to keep the pressure off the NHS. When we were expecting nationally, we were all expecting huge numbers of people to have to go into hospital because they were ill with COVID. And so hospitals did what they could to make sure they had sufficient space and beds. And at that time, all the big scale up of testing wasn't available. So that doesn't happen now. Now, when people are discharged from the RUH to care homes, they're tested, they have a COVID test before they leave. So hopefully that won't be repeated in the future. There's been such a big emphasis on care homes nationally from the government that hopefully we won't go back to those times again when all of the emphasis is on the NHS. I think it's probably fair to say now we're in the middle of summer, lots of people are outdoors. We're probably at the low point in terms of cases of COVID. And it's inevitable that we're going to start to see slight rises in cases as people mix more, as all the social restrictions come off. As Rob mentioned in terms of social distancing and hand hygiene, we all know what to do, but sometimes we can all become, or many people can become a little bit complacent and a little bit bored with the difficulties of talking to your good friends from 2 meters away. And so people can forget and become a little bit complacent. And that is to be expected, but our aim and our aim as community leaders and your contribution to that is to try to minimise that as far as possible. So all councils recently have been given a greater responsibility from the government to coordinate and to think about what they can do with their partners to reduce outbreaks from happening, and what they can do to help make those outbreaks as small as possible if they do occur. So all local authorities have been given that leadership role and have been instructed by government to produce something called the Local Outbreak Management Plan, which we call a LOMP. And then there is a regional outbreak management plan called a ROMP. So you can have a ROMP and a LOMP. The Tower one in Baines is the LOMP, the Local Outbreak Management Plan, and all local areas have had to produce one. We had to produce it at very short notice, so that's been done. And that gives us a framework for how the council will work with the partners, with the NHS, with regional partners, with Public Health England, with local communities, how it will both work with all those people to prevent outbreaks from happening and to reduce the impact if they do. So the purpose of an outbreak management plan is to try to make it as easy as possible for all of us and all our residents to resume our lives as much as we can, while also keeping all of us safe from COVID. So over the coming months, there are probably 3 main aspects of outbreak control, of controlling outbreaks. There's the stuff that the public health team does with Public Health England, which is a national organisation, and with other partners about coordinating and managing outbreaks. So if an outbreak does happen, and you'll have heard on the news the one that's happened in Swindon, are people familiar with that or heard it on local news? Yeah, lots of nods. So there's been a big outbreak in Swindon, so the responsibility to manage that lies with the health protection team in Public Health England, working in partnership with the local authorities public health team, and then working very, very closely with the employing organisation affected, community organisations, because the need is to get information out there as quickly as possible. So that's one pillar. How do we very quickly get on top of outbreaks? The other pillar is the important role that we have as a council, and that all local leaders and parish councils and yourselves all have, about how can we encourage people to maintain and follow the rules, to maintain social distancing, to not meet in more than 6 people, with more than 6 people in somebody's back garden, all those rules that can be sometimes quite complex because they can appear to be contradictory, and they're not if you read them in detail, but they can be complicated sometimes. But what's our role, and how can we help ourselves and the people who we serve to follow those rules, and to make sure that we spread that message that all of us have the responsibility to follow them, because that's the only way we're going to prevent outbreaks in the future, until we either get a vaccine or until there are such excellent treatments that even if someone becomes ill, it doesn't matter because they can be treated, and we're a long way from that yet. So that's the role, that's the second pillar. How can we all encourage our local communities to follow the rules and comply with policies, and apply with lockdown if it's needed? And then the third equally important role is the one that Rob's talked about with Compassionate Communities Hub, and that Claire is so heavily involved in. And that's the role of communities to look after itself and each other, and the role of the Compassionate Communities Hub, so that if people do need to lock down, or if they're in real need because they've been made unemployed, or they're struggling because they're on furlough, or they've been told to self-isolate, but they're not entitled to statutory sick pay, and so they're really feeling that need to go back to work even if they're feeling ill. How can local communities and Compassionate Communities Hub support local people in need like that? So those are the sort of 3 pillars. The stuff that Public Health team does with Public Health England and other partners about managing outbreaks. The stuff that we all do in our leadership roles in council, in the local authorities and in our communities, to encourage people to abide by the policies. And then how do we support people in our local areas who are in need? And there's been such tremendous examples of that, haven't there? I'm sure locally we can all think of examples on our streets about how people have really come together to help each other. And it can be difficult to maintain that behaviour, that good behaviour, but we're going to have to do it until we get a vaccine. And it is difficult, isn't it? You know, I walked along my local streets the other day over the weekend, and there was a group of about 10 or 12 teenagers all leaning over each other, looking at phones, looking at their devices. There's no way they're all from one household or even 2 households. They're a bunch of friends who haven't had an opportunity to get out and about much. Now they are not following those guidelines. So, but that's what we need to do. And so it's just thinking, how can we play our role in that? In terms of lockdown plans, plan A really is to avoid it. We absolutely want to avoid needing a lockdown plan. And so the way we can avoid it is through good prevention and identifying potential outbreaks as soon as they happen. If they do start to happen, then the next step is for us to give good warning. If we start to see increasing cases generally, to give really good warning locally in specific areas or specific employment industries. And then the final plan would be to look case by case to see what sort of lockdown is needed, if that is what's needed. If we feel we're losing control, what is it that's needed? Is it a lockdown in a very specific geographical area? Is it a lockdown in terms of, I've forgotten the word, but times that people can go out and not go out? There's a word for that, isn't there? And you can't go out after 8 p.m. curfew, that's the word. So is the lockdown related to curfew? Is it related, as it was in Barcelona in Spain, to closing all the nightclubs for a period of time? So it all depends what it is that's fueling the outbreak. So there's no fixed plan in terms of what would be locked down if it ever was needed. It would be the last resort, because we'd really want to focus on good prevention and giving good warnings. But if it needed to happen, it would need to happen. And local authorities have been given powers to stop certain events from happening if those are considered to be increasing the risk of virus transmission. And then you'll all be familiar with or have heard about testing, isolating and tracing. So we've got the test, isolate and trace, the NHS test, isolate and trace. So that's people who are cases. Then there's the contact tracing process. So people who then have been in contact with them are then phoned, ideally, the system is obviously building up, will be contacted by them and told that they need to isolate for 14 days because they've been in contact with somebody who is a case. So that's it really. I suppose I haven't really talked about the challenges, and it is challenging. Guidance change regularly, and that's not surprising because nationally, all of us, the scientists and the government have been learning about the virus week by week, month by month. It's new to the human race. So as the scientists and experts have learned about it, so the guidance has developed, changed, become strengthened, new guidance come out. So that's certainly the key challenge, keeping on top of the guidance. But I'll probably stop there if that's okay.
Okay,
Great.
thank you, Becky.
Take any questions. Thank you.
Thanks very much. So, I had a question from Karen first, I think, if that's okay. And could you just say who you are as well before? And
yes, of course.
Okay.
So my name is Karen Warrington. I'm a Bath and North East Somerset councillor. I represent the Chew Valley along with Vic Pritchard, who's probably here today. So I guess this is a question for really both of you. You probably are aware that today a pop-up campsite in the middle of a field on the edge of two parishes, actually on the boundary, started today. And residents have been phoning the parish councils, emailing me constantly, phoning me. With regards to this, it's 4 weeks. Now, under the coronavirus 2020, section 52, it's schedule 22, confers on powers on the local authority, which allows the local authority to close down premises and cancel events and even reduce numbers. Just to give you a bit of background, I know that assessments are going to be done tomorrow, but I just wonder whether there's anything in place, because clearly a lot of people are going to be coming from outside the area. And I just wondered if something is in place in case that does provide us with a spike, because people are being encouraged to leave that campsite and go off into the villages and the walkways and the SSSI, etc. So, and Becky, you said that Plan A is prevention. To be honest with you, a lot of my residents don't think that this event going ahead is prevention. So I just wonder what your comments are on that.
Shall I pick that one up, Becky?
Can we be? I want to be really careful that we're talking about forum matters and not individual local matters. So if you could address it from a general point of view, is that okay, Rob?
Yeah, you most definitely. I mean, this has been, there's been a lot of discussions about this, and as I said, Karen is right. I think there is some sort of assessment going on tomorrow. There was two particular areas of concern. One is obviously for the public health, and the other one was through the licence and planning, and those are the elements that are being addressed. And what I will do, I will ensure that both the ward councillors are informed of the progress of those discussions, because they should be anyway. I think everybody can understand the nervousness. I mean, I have it exactly in my own ward where someone wants to have a fun day and you've got to try and sort of balance up, sort of certainly around the public health. And I think in a way, the public health consideration has always got to be top trump. Okay, so that's if that's all right, Chris, that's really all I can put into it, and I will make sure that they get meaningful feedback.
Thank you. Thanks, Rob. That's great. Karen, is that? I mean, obviously this is something which has come up before, so
Yes, it is, and it does affect the whole of the Chew Valley.
Yeah,
it's not just one small area.
Yeah.
It will affect the whole of the Chew Valley and beyond. And I think I did hear in the last few weeks that somebody who used to attend this forum died of COVID. So, you know, and we probably, a lot of us would have known that individual. So it is forefront in our minds for the whole of the community.
Okay. So could you take that one, Rob, and make sure that that's fed back?
No problem at all.
Thank you. So has anybody else got any direct questions for either Becky or for Rob on what was said just a second ago? If not, we'll ping up the couple of questions, which we'll give a few minutes to as a sort of as a way of triggering some questions. Oh. I've got a question in the sidebar from a Jackie, and I should declare an interest here that this is my wife. Is it possible a lockdown could be for certain groups and not others? I'm speaking as someone who's been shielded. So that's a question for Becky, really. So about lockdown, could it be for certain groups, or will it be for areas or for?
That's a really good question. I think local lockdowns are very, very new, and we're very pleased that we're not in the forefront of this. I think we'd have to say that nothing can be ruled out at the moment, because it would absolutely all be based on a really good understanding of what was leading to the lockdown. I'm not aware, but I've not looked in detail, I'm not aware that any of the other local outbreaks in England have put a lockdown on specific groups. It's more on activities, and it's more on the rules that people as a whole can do that might affect a particular geographical population and not affect those on the neighbouring road. But I've not heard of any local lockdowns that would include, for example, all 40 to 50-year-olds, because it's got to have an evidence base behind it, and it's got to be, what you're trying to do is break the chain of transmission. So you've got to have understanding of where that transmission is occurring and close the venue. And so it's more around closing the contact, whether it's to a workplace or to an employment agency or to a nightclub, that a local lockdown would be imposed.
Okay, thank you. Thanks, Becky. So there's a question from Denise. Care homes, is there now a system for treating all Baines care homes the same regarding PPE and testing, whether they're privately run or otherwise?
You're going to take that, Becky?
Yes, my understanding is that they're all treated the same. So the council we regularly email all of our care homes. There's a good care home provider forum. If people are aware, so if Denise from Village Agents is aware of any care homes that aren't being contacted by the local authority when we send out our updates, I would really appreciate knowing that. So yes, so all care homes are now asked by the government to take part in weekly testing of staff, COVID testing of staff, and testing of all residents every 28 days. So that national programme has slowed down a bit because they're struggling with having to meet the capacity. But that is for all care homes. That's not just care homes that's all care homes. So yes, if anyone's aware of any care homes that aren't being treated the same from the local authorities, public health sharing of information perspective and access to PPE, please do let me know.
Okay, Rob, did you want to come back on that one, Rob?
Yeah, I can understand where the concerns have come from, because I think at the beginning of this process, the care homes nationally were not best served by what happened in terms of creating the capacity from the hospitals and everything like this. But we, like many other authorities, have put in place very strong platforms of support for care homes, which often meant not only weekly, but obviously in daily contact with care homes, and a process to ensure that things like PPE, if they get down to critical levels, they can come to us for that support on PPE. Primarily, they are private businesses and everything like this, so we do ask them to go and source their PPE, but nobody is left without the support of the authority if they find that's difficult. And obviously the testing regime has now been put in place, which should give support. And I believe they've now started to just change slightly the visitation element of it as well, to enable people to go and see their loved ones.
Okay, thanks, Rob. So a question from Colin, is Baines on course to reopen schools fully at the beginning of September?
My understanding is that it is, but I've not spoken to the Director of Education recently to know whether, because he is the one who's been in regular contact with the schools to find out their plans for opening. So during July, before schools closed, yes, that was the plan. And I've not heard anything different since then. Okay. There's a really good webinar. There's lots of webinars and trainings that are being put on for schools. So yes, I've not heard any different. That's the plan from last I heard from the Director of Education.
Okay, is that so? I mean, most of us have got sort of primary schools in our area. Obviously, where we would normally meet, Chew Valley School, that was open for year 10s and year 12s at the end of last term. It'll be very interesting to see how they manage to open schools with a full population or full cohort of students. No, in the year 6s and receptions in the primary schools in our communities as well were open. Okay. Any other questions in this? I've got no other questions in the sidebar for Becky and for Rob.
Could I just give a bit of information on 2 other points, Chris?
Go ahead, Rob. Yeah.
Very briefly, I know it's not going to be part of the discussion, but I think it's important for the forum to understand, is about finance, about the council finance. Of
course, yeah.
As everybody would have read, that we had a massive gap, a 53 million pound gap in our finances. We received just over 10 million pounds worth of support for specific areas. There was a promise that all COVID activity will be covered in various ways. Obviously, that gets firmed up, and it wasn't as we thought. But at the beginning, the council or the cabinet and members went and produced new sets of accounts, which were on 3 bases. One, if we only received 25% of the shortfall. Second on 50%, and third on 75%. So there are strong recovery plans available, and we enact the one that's appropriate. And it looks like we're going for the amber at the moment, which is we are only expecting 50% of the cost coming back to the council. So, and we have to put the recovery in place in this year, because that's the way council accounting works. We couldn't do a 3-year recovery plan, everything like this. And then the second point, if I can, is that I think you mentioned it, Chris, and likewise my wife, she shielded for the last sort of 3 or 4 months and things like this. And the biggest challenge they have is actually confidence going out there. So we as a community, if we actually want to give anybody a gift, and that is basically tolerance to those people that are venturing out into our community, we're going to be asked to do things that to us are going to be slightly inconvenienced, but actually will make a huge difference to this number of people. And there are a lot of them that are venturing out into our community. So if I was to ask for anything, can we all show tolerance and consideration to those cohorts if we can, because it will make a huge amount of difference to them.
Okay, thanks Rob for that. Sarah, have we got? I mean, we have got a couple of questions which we're sort of going to trigger some sort of discussions. But rather than put them up, Sarah, because I'm just mindful of the time, there was just one which I really wanted just to. I mean, there's sort of things that you can take back, the questions that you can take back to your own community and ask your own community anyway. But one of them was particularly around mental health and mental health support. So it kind of ties in with what Rob was just saying at the end there. And it was just really how as communities that you think you can be best supported, and what how you would identify need and how you would ask for that need from a mental health point of view. Sarah's put the question up. So what can we do to ensure people with mental health issues have the right support? And when we're talking about mental health, we're not talking about people who need to go to the doctors. In sort of health parlance, there's sort of various levels. We're talking about level 1 interventions, which is very, very low level interventions, but they are critically important to prevent people then needing to then escalate it up. So it is that thing about Rob said about tolerance. It's about just having chats with people. It's about making sure your neighbours are okay, fluctuating. So has anybody got any observations on that at a this is at a local level? And Denise has asked to speak. Thank you, using the proper parlance. So thank you, Denise.
Hi, just very quickly, along the lines of one of the pillars that picking up a number of points about consideration, etc., etc. I was talking to someone yesterday, and they were telling me that their grandson had been going to the local pub, which is fantastic. He's a young lad. But they weren't bothering to, everyone, you know, it started off very well with them signing in as they came in. He said, oh, nobody bothers with all that stuff anymore. And it's those sorts of stories that get out there that undermine the confidence of people going out. I mean, most of the people that the village agents are supporting are just not wanting to go anywhere. So we're trying to slowly coach people into having confidence to go out, learn how to distance, because they haven't had to, learn how to wear the face masks and when and where. But I think the problem is if the poor practice is happening locally, it's starting to be known that that's what isn't happening. Or you drive past a pub and you can, as you say, you can see groups of people, or the poor practice. And unfortunately, it's the poor practice that gets known locally first, rather than the excellent practices, because we've had a lot of excellent things happening in the valley, but it's these poor practices that are undermining and it is mental health. It is the mental welfare and well-being of people feeling that they've got, losing hope that this will ever end, having despair and that it's going to go on forevermore. It's
okay. So thanks, Denise. So Sarah's just put up in the sidebar a couple of things. I noticed Colin's busy scribbling stuff down. We will make sure that all the stuff is distributed afterwards, so you've got a link to all of that. But basically, Bath Mind are supplying some support as well through the hub. And there's this thing called Breathing Space, which I wasn't familiar with, which sounds interesting. But Bath Mind are doing that, been doing a really great job. So I think the message back to everyone is that there is support available, and that you need to ask for it. Don't let people sort of suffer in silence. You've really got to ask for it and to support it. And so part of the role of the forum and you as members is to know that that is available. And again, this isn't major big scale stuff. This is very low level, but very important and very critical in people's lives and how they deal with things. So I'm just any other, I'm trying to dabble between my two screens at the moment just to see if anybody else wants to come in. No? Is that okay? So what we will do, so we will make sure that when the notes come out to everyone, that not only, because Sarah's also put in a link to the lockdown or the outbreak management plan, which is quite a, I have to be honest, is quite a lengthy document, having reviewed it, but also the other stuff. So we'll make sure those form part of the notes, if that's okay. So I'd like to say thank you to Becky, and I've been working with Becky's boss Bruce for a long time, and I have huge amount of respect for Bruce and Becky, as well as other councillors involved in this. But the work of the public health team has been amazing in keeping everyone safe in all of this. So thank you, Becky and Bruce, who is on a deserved holiday, I have to say. So
thank you. You're very kind. It is very much a partnership approach, though. But thank you. Okay. Yeah, we'll all work together on this.
Brilliant. And Denise has just put up a note about that. Is this type of information being made available to parish councils to pass on to their communities? So yes, I think is the answer. This should be available for parish councils, but we will make sure that, again, this is all distilled out as part of that sort of parish council information working. So yes, there's also the interagency meetings that happen on a fairly frequent basis. 2 monthly, is it, Sarah? Just nod your head. 1 monthly, yeah, 1 monthly. But actually one of the advantages of doing all this work on Zoom is that actually it does feel as though there's much more contact between agencies and between partners than there was in the past. Although it's virtual, there is actually much more linking up with what people are doing. So it's quite good. Right, I'm going to bring that agenda item to a close, if I may. And then I'll take you back to, you really need to cast your mind back a very long time to before COVID, to BC. And when we had our last meeting, we were talking about another thing, which was called climate change and the climate emergency. And we had a very productive meeting, which Jane Wildblight came to, and Sarah Warren spoke at, and we had a good discussion. We had Bath and West Community Energy came along. And it was a discussion which focused quite a lot on some sort of area-wide initiatives and what Baines was doing and Bath and West Energy were doing. And I know a number of parish councils were at different stages in the process about where they were going with their own climate emergency declarations. And basically what we wanted to do was we wanted to have a very short discussion about an outcome of our meeting, which was to form a Chew Valley cross-parish climate emergency working group. And hopefully you got out in your papers, or Sarah sent out last week, a sort of a draft terms of reference for that. And I wanted to get Nick to speak to it, but where are you, Nick? Oh, there you are. Right. Nick, are you able to speak to that from the floor, or as it were, from the floor? This is where I get you to stand up now, but you don't need to.
Can everyone hear me okay? You got me?
Could you introduce yourself as well and stuff like that?
Hi, so I think you can all hear me.
Yep.
So yeah, I'm Nick Baker from Chewstoke Parish Council. I've been working alongside Chris Craig from Compton Martin and Jackie Head from East Harptree on putting together this proposal. Chris, would you suggest that I share those terms of reference on the screen so people can see it if they haven't done so already?
Has everyone got the terms of reference? I think we'll assume everyone's got them, Nick. If they haven't, okay, we'll send them out. But it was just really just to very, very roughly talk about what the purpose of the group really was.
Yeah. Okay. Well, I'll talk through those as I go through this. So the proposal that we're putting to the forum is that the member parishes join together to form the Chew Valley Climate Emergency Environment Working Group. In terms of the terms of reference, the adopted terms of reference for the Chew Valley Area Forum allow for working parties and groups to be established for undertaking specific tasks agreed by the forum. So we're working on that basis in putting forward this proposal. So in looking at this, we've reviewed what all the various parish councils are doing. Out of the 15 parish members of the forum group, there are currently 4 or 5 parishes that have declared climate change emergencies and formed working groups. And they are already working collaboratively together on actions and ideas. So those 4 parishes are Chew Magna, East Harptree, West Harptree and Compton Martin. Of the remaining 10 or so parishes, I gather that most of them have expressed interest in making declarations and forming working groups, but for whatever reason haven't yet progressed those ideas. I'm speaking personally as a parish councillor from Chewstoke. We're in that latter category, and we've had trouble getting to grips with this, understanding what we should be doing. I think we felt that we've lacked experience, and to be honest, there's been somewhat lack of enthusiasm and commitment to take things forward. So, speaking personally, and based on my experience, I would really welcome the opportunity of joining together with our other parishes to form a working group like this. I mean, off the top of my head, I can think of many ways in which we can work together in a more collective and powerful way. As a parish council, we've been talking about lots of green issues recently. And just one example which sort of kick-started this whole idea was the need to engage with local businesses and organisations to address climate change issues. We have had recent dialogue with Bristol Water about various ideas in which we could engage with them at a parish level to bring forward ways in which we can improve the local environment. Now, as one parish council speaking to Bristol Water, we don't have much of a voice, but if we have a situation where we work collectively and Bristol Water find themselves talking to a group of people who represent all the parishes in the Chew Valley, we would have a lot stronger voice. So that's one good example of where we would work together collectively. And then there are all sorts of other ideas that we've been talking about around our parish council, where I can see us working together more powerfully in a collective manner. For instance, in Chew State, we're talking about forming car clubs. Now, in a village our size, we just don't get the economies of scale to be able to do that. So again, working collectively, we can review ways in which we can bring forward ideas like that. Chew State Parish Council is looking at an alternative energy generation scheme at the moment, and I know a number of other parish councils in the valley are also looking at doing that. It would be great to share our notes and experience in a forum like this, so we can develop our ideas both collectively and also individually as parish councils.
Okay, Nick.
So all sorts of initiatives like that, which we can work together on.
Brilliant, Nick.
Yeah.
Nick, sorry, thank you. I'm very conscious of time, and so basically, so I've got a question from Karen, if I can, and then one from Jackie. Is that all right, Nick? And then we can...
Yeah, sure.
Yeah. So Karen first, please.
Yeah. Sorry, it wasn't so much of a question, but hopefully I can be helpful. I've just recently attended a climate action day, and they came up with some really good information. I'm very happy to share a number of URLs and where we can get some great information.
Brilliant, thanks. Was that the CSE one?
Yes.
Excellent,
yeah.
Thank you.
Yeah.
And Jackie?
And it was really good.
Jackie?
Just the point I wanted to make was when these terms of reference were put together, we were quite keen that it shouldn't be just parish councillors who could become part of this group, So it would be parish councillors, but also it could be members of climate and emergency working groups that are happening across the valley, and also could co-opt people who had particular expertise that they could bring to the group, because I think having it with an action focus and with clear evidence-based choices being made would be very helpful. And I think that's more likely if you've got people who have some level of expertise to bring to the group.
Okay, thanks for that. So just absolutely clarify, under our existing forum's terms of reference, we are allowed to set up it's actually called a working party, but we're going to call it a working group. We're absolutely allowed to do that. These are all pulled from our terms of reference. So we're going to pull that together. Sorry, Denise had a question I've just seen come up.
Sorry, Chris, there's a lot happening here. A question about the terms of reference, and thank you very much for putting those out. I had read them before. Bearing in mind that the role of the working group would be to represent, as far as anybody can, communities in things like consultation with Bristol Water or Baines or any other agency, would it be necessary, or would it be a good idea to have a representative of a parish council plus, as Jackie said, anybody else as part of the pair, simply because the parish council is the only elected representative body who can act as a statutory stakeholder?
I think we've kind of dealt with that in the terms of reference membership, which says the eligible parish representative will either be a parish council, member of the parish climate and nature working group, or members of the parish with specific role. I mean, basically,
no, sorry, Chris. What I meant was that it's the either. I would suggest that you need at least one parish council representative plus somebody else in order to have the authority of representation from the valley.
Yeah, and again, this is a sort of slightly developmental point for the forums. Is the forums themselves we have no fiduciary duty. You know, we don't have any money. We don't have any power to do things. If things were done, you would have to create either a special purpose vehicle or a parish council would have to take it on anyway. This is just as a way of getting people together to get things started. So it's an enabling forum rather than this forum wouldn't be able to take on a contract or get money or anything like that at this stage. It might be in the future, but at this stage we wouldn't be able to. So I'm fairly, I think, having talked to Sarah about it, I'm fairly relaxed about that at this stage. But it's very clear that in order to limit the size of the group, we need to have only limited to 2 representatives per parish council. I think that was what we were trying to say. But it's a live point, Bernice, and something that it certainly will be keeping under constant review. But sorry, am I right in saying this is the first sort of working party to come out of a forum?
Yes, as far as I know, and I think, the Bath City Forum did have working groups. But of course they operate in a slightly different way. But this isn't to replace the roles and responsibilities of a parish council.
Yeah.
This is really just to take forward some ideas.
Yeah.
And the idea would be is for those representatives to go back to their parish councils to report on it. So it's not to replace any statutory duty.
No.
The parish councils
Right. Sorry, Sarah's still at the end of her tunnel there, so I hope you all got that. Basically, this isn't this, and this is again really, really clear. This isn't doing this. The role of parish councils is still primary, as is the role of elected members on Baines Council is still primary. This is much more around joint working and working together to share best practice and share information and share learning, as well as taking things forward where you need a critical mass of groups working together. So I think that was really it. So, and again, not wanting to sort of filibuster this through or anything, but can I just, is it possible to have a quick sort of show of virtual hands or show of actual hands if you're happy that the forum adopt these as the terms of reference and that we get this going, we get this underway straight away? So those people who are voting members, I'm assuming, Heather, have you put your hand up, Heather? Oh yeah, Heather's put a hand up in the sidebar. Thank you very much. So I think, so can we take that as read that this is, we've adopted this as a terms of reference for the first working group, and we will ask them to report back every meeting, and it's a working group for a 12-month period of time, at which point then we will review the terms of reference again. Is that okay? Right. Well, that's exciting. There you go. We got ourselves a working group. So we'll be needing to ask for we've got a thumbs up from Nick as well. So thank you, Nick, for that. We will ask each. We will convene members from each parish council. We'll get those together, and we'll do that outside of this meeting. I did really want to finish at 6 o'clock. So unless anybody has got any other business which you didn't raise with me before the meeting, which is the normal rules for AOB. We would close the meeting, but just in case. So yeah, we did have a police report. I did say the police report earlier, and you are going to send that out later. So I don't think there was anything. Has anybody got anything else urgent they need? Oh, sorry, my wife wants to say something. Sorry, go on quick.
I did put "may I speak" in the thing. I just wanted to say that in response to what Bernice said, that I think from my sussing out of local parish councils, there might not be a parish councillor who has availability or interest to join this group at this time. And it would be a shame if that area didn't get to be part of the conversation. So I think it's actually really important that 2 people from each area come in, preferably, yes, a parish councillor and 1 other, but where that isn't possible, to still have 2 people from that area.
Okay, right, we will take that offline. Excellent. Okay, right, and I think someone called Alex has just joined the meeting, which is a bit unfortunate because I'm just about to end it. Okay, well, thank you very much, everyone, for taking part in this virtual meeting, and we will reconvene at a point to be agreed. Sarah will send the stuff out, and thank you all very much for your contributions, and thank you for taking part in this meeting, and stay safe. Cheers then. Bye.
Thank you. Night.